So what happens to a woman in the perimenopause? Well, to explain that, it might be helpful to talk a little bit about premenopause or during the reproductive years and what's happening there. During the normal menstrual cycle that a woman goes through, ovarian hormone levels are rising and falling throughout the cycle based on communication between the ovary and hormones that the pituitary gland is producing, and the range of the rise and fall of these hormones is quite significant. A lot of women would tell you that they can tell when they're about to start their period because they will begin to experience bloating, fatigue, breast tenderness, mood swings, all of those sorts of things during a normal menstrual cycle. And we even have a diagnosis, a recognized diagnosis for patients who are having significant problems during their premenopausal years called PMS, or premenstrual syndrome. So when we go into the perimenopause and these hormone fluctuations are even larger, then the symptoms can become even more severe for those patients. Menopause is a time of life for women when their periods stop and their hormone levels drop. And the definition of menopause is the final menstrual period. Now, for patients who aren't having periods because they've had a hysterectomy or for other reasons, it's basically the time when that would have happened. And of course, there can be a natural menopause and a surgical menopause. A natural menopause is when things happen naturally. Women who have had to have their ovaries removed for some reason surgically, then they are going through what is said to be a surgical menopause at that time. Now, the explanation for why menopause occurs has to do with the fact that the ovaries stop producing hormones. And the reason why they stop producing hormones is because they run out of eggs. Each egg is surrounded by a nest of cells called follicle cells. And these follicle cells are the cells which are producing the hormones. So once these eggs are completely depleted, then the follicle cells are depleted and there are no more hormones, final menstrual period, and then the menopause occurs. So the time of a woman's life that is after menopause we call postmenopause, and before menopause we might call premenopause, or the reproductive years. So what is perimenopause? Going from premenopause to postmenopause is not like a switch turning off. It's a more gradual winding down process, and this is what we refer to as the perimenopause, or now sometimes a term I like to use is the menopause transition. And this lasts for several years. It could be even up to 6 years in length, and it is described or characterized by what is happening to the periods. In the early stage of menopause, periods may come early, 7 days or so, or maybe 7 days late. In the later stage of the menopause transition, patients will begin skipping 60 days, 90 days, 6 months, and at this point, the final menstrual period is probably within the next 1 to 2 years.